Hello, my name is Jeff Moffitt with Draeger, and welcome to our use case, Silent Pediatric ICU for Improved Patient Care. Today we'll be telling the story of Harper, a pediatric patient who was involved in a car accident and has experienced multiple traumatic injuries and is now in our ICU being ventilated. Our focus is to provide high-quality, safe patient care while leveraging the latest technological advances. Research has shown that high noise levels in ICUs detract from a healing environment and is suspected of being a major risk for patient delirium, which is associated with longer length of stay, increased readmission rates, cognitive and functional impairment, as well as increased mortality. The high level of noise that exists in patient rooms is created in large part by the multitude of alarms from the medical devices used to care for Harper, and we want to address this issue. For the sake of an example, this is what Harper's patient room sounds like today. Now, imagine how this almost constant bombardment of noise can affect Harper's ability to recover from her injuries. In this use case, we want to show how utilizing open interoperability technology based on the ISO IEEE 11073 Service-Oriented Device Connectivity Standard, or SDC, can enable the safe distribution of all medical alarms regardless of vendor, allowing the bedside devices to remain silent for a true healing environment within the patient's room. Today, Harper is being monitored using a multimodality system for data aggregation, remote intervention from a medical-grade PC, and most importantly, reliable forwarding of alarm data and associated information to the appropriate nurses. This alarm forwarding technology, based on the SDC standard, enables a bedside device to stay silent. Therefore, neither Harper nor her parents are distressed when an alarm occurs. Designated nurses will receive all information about their assigned patients' alarms directly on their handheld devices, and the alarm information will also be displayed on a dashboard located at the nurses' station. Now please, listen for the silence.
My name is Alyssa, and today I'm going to be Harper's nurse. Harper is a pediatric critically ill patient who is sedated and ventilated. She is currently undergoing weaning trials where we are decreasing her sedation medication on the B-run syringe pump in the hopes of extubating her from her Draeger ventilator. Now, before I can enter Harper's room, a near end of infusion alarm occurs on the syringe pump, indicating that her sedation medication is nearly empty. There is a visual prompt on the infusion pump, but where we would normally hear an audible alarm, this new technology allows for the infusion pump to remain silent.
What we have seen up to now is that the device at the bedside was silent. This was due to the fact that there is a reliable communication of alarms based on SDC communication protocol. At the same time, the alarm notification was presented in the ASCOM dashboard on the nurse area, but as well on the ASCOM and the mobile of assigned nurse to the patient. Together with the notification, what is important is that we are going to provide additional information, contextual information like the kind of priority of the alarm and as well the medication. These are information quite important for the nurse in order to take decisions, to decide what to do. In this situation, for example, the nurse in charge can decide to acknowledge the alarm, then continue the activities with the existing patient, then prepare the drugs for Harper, and then move to the Harper room.
So unfortunately, the day's workload prevents me from attending to Harper's near of infusion alarm, and her syringe runs empty. Now that she is no longer receiving her sedation medication, her heart rate increases as well as her respiratory rate, triggering new alarms on the patient monitor and her ventilator. Now notice how all of the devices in the room remain silent.
We've just demonstrated how we reliably distribute the alarms from medical devices from inside of the patient room to the outside to a central dashboard and to a mobile device of the nurse. And to further enhance the workflow of the nurse, we also provide an aggregated overview of the patient status information on a medical grade PC that is located in front of the patient room. Based on the standardization with SDC, we aggregate monitoring, ventilation, and infusion pump data in a central overview to enhance clinical decision making. So the benefit is very clear that the nurse can already assess the patient's situation before even entering the room.
So due to Harper's worsening conditions, I rush back into her room and I can acknowledge the alarms on the patient monitor, ventilator, and the infusion pump, and replace her sedation syringe. Now that Harper has stabilized, I can exit the room and continue my prior tasks.
The scenario that we have seen so far explains that thanks to reliable forwarding of alarms based on SDC, the medical device at the bedside can be silent. This is very important because it's enabling a better patient healing, but as well less stress for the family. But what happens if we have a problem in the network or in the infrastructure? In this situation, the medical device at the bedside will take back the sound, so will start sounding in case of an alarm, and at the same moment, as well, the dashboard of the nurse station, together with the ASCOM mobile, will notify alarm notification that will inform the nurse about a problem in the network. This is very important because in this way, the nurse can take actions in order to be able to hear better the alarms. For example, she can open the doors in order to take action.
So if we replay the previous scenario, Harper's heart rate and respiratory rate have increased while there is a network connection error. The ventilator will audibly alarm in her room. Now, as her nurse, I can hear this alarm from outside of her room, so I can come in, acknowledge the alarm, and explain the situation to Harper and her family to decrease their anxiety related to the noise caused by the alarms. Once the system has reconnected, alarms are reliably forwarded and the devices then again switch into the silent mode. The operational state of the system is indicated by the medical devices as well as the ASCOM dashboard.
Hi. So Epic's role in this use case is as the EHR and to integrate with the bedside devices to receive data which will file into the patient's chart. So once Alyssa is done with her shift and is satisfied and comfortable with the care that Harper has received, she will go into Epic to complete her documentation. Some of that documentation includes validating information that is received electronically from the Draeger and Bebron devices using IHE PCD standards. So Alyssa will validate the information that was received electronically in Epic and check the values to make sure that she is comfortable with what will be filed into the patient's chart. By integrating with Draeger and Bebron devices, there is a manual validation step that Alyssa must do in order for the values to file to the patient's chart. Once the data is validated and filed, Alyssa feels confident with the care that Harper has received.
Okay, thank you for watching and listening to our showcase, Silent Pediatric ICU for Improved Patient Care. We hope you'll agree that we have demonstrated how utilizing open interoperability technology based on the SDC standard can enable the safe distribution of all medical alarms, regardless of vendor, allowing the bedside devices to remain silent within the patient's room. Having a silent patient room with alarm forwarding technology not only supports patient healing, but potentially prevents the development of delirium and improves workflows for the PICU nurses and other caregivers. Lastly, it's important to note the information we've spoken about in this use case is preliminary, and these solutions are under development and are for demonstration purposes only and are not intended for clinical use. They do not have CE approval, nor have they been submitted for FDA 510(k) clearance.